Hi, I'm Dr. Larry Malerba, and welcome back to the ATH Clinical Case Series. Today's case illustrates both the breadth and depth of action of an effective homeopathic prescription. In this case, a single remedy acts broadly, helping multiple health problems on different levels, and also acts deeply by resolving some problematic behavioral issues too. Tyler is a 2-year-old boy with multiple health issues, the most immediate one of which is a rash that covers most of his body. The rash is flat and red, but not itchy. His parents explain that he's had a similar rash several times before. Each time it seemed to occur in close proximity to Tyler's most recent vaccination. Each episode also resulted in swollen welts and purple dots at the vaccine injection site. In addition, Tyler has eczema on his forearms, which tends to flare up in wintertime. In his short life, Tyler has also had several ear infections, 3 bouts of bronchiolitis, which is a little like a kid's version of bronchitis, and frequent upper respiratory infections. Tyler's typical ear infection consists of mild fever, pulling on his ears, inconsolable screaming, and excruciating pain that can keep him up at night. According to his parents, most of these illnesses, too, seemed to come close on the heels of a prior vaccination. Tyler's mom had a healthy pregnancy. Of particular interest to me is the fact that during the pregnancy, she craved ice cream and drank 3 glasses of milk per day. Tyler was over 9 pounds at birth and nursed until he was 10 months old, at which point he would frequently spit up and become inconsolable after nursing. An attempt to switch to cow's milk was also problematic because it caused him to have bright green loose stools. I asked about some of the generals of Tyler's case. He was warm-blooded and often kicked the covers off in sleep. He was picky about what he'd eat, but he had a good appetite. Favorite foods included hot dogs, steak, strawberries, bananas, grilled cheese sandwiches, mac and cheese, and pasta with butter. When I asked about his taste preferences, given the choice between sweet, sour, salty, and spicy, Tyler liked salty first and sweet second. He sleeps well and is often found sleeping in the genupectoral position, which is just a fancy term for sleeping on his folded knees with his rear end sticking up in the air. I asked about Tyler's fears, but his parents weren't aware of any. Temperamentally speaking, Tyler tends to be emotional, dramatic, and reckless. He grabs things, runs into things, and he's always going. He can throw a tantrum several times per week. In such cases, he can hit people and throw himself on the floor. He likes to wrestle with his sister, and he can hit the dog. He doesn't watch TV, he won't sit on his parents' laps, and he screams if he doesn't get what he wants. In terms of language, thus far, he only speaks a few words. With this information in mind, I decided to prescribe a couple doses of homeopathic tuberculinum 30C. Tyler's mom called 10 days later to report that his rash had completely disappeared within 48 hours, and his behavior had improved. But today he had several bouts with diarrhea. I calculated that this was an acceptable trade-off. I asked her to wait and to call back if the diarrhea persisted. At the 1-month follow-up visit, Tyler had improved in many ways. His rash was gone, and there were a number of positive changes in his behavior. His mom reported that he's able to sit still. It seemed like it happened overnight. He's more affectionate, kissing and hugging. He's sitting on our laps. We haven't noticed any tantrums. He's not screaming if he can't get what he wants. He's been nicer to the dog, and he's playing with his sister more. He's saying lots of new words. His teacher's so impressed. He's been putting 2 and 3 words together. The diarrhea had started about 10 days after taking the remedy and continued to occur 5 to 6 times per day for the following 9 days until it finally began to slow down. It was still happening, but less so. I decided that the best thing to do was to wait and to not repeat the remedy. I didn't receive any further feedback about Tyler until his mom brought his older brother in for treatment 6 months later. She made a point of telling me how well Tyler was doing. I can't say enough about how wonderful he is. He's not violent anymore. He hasn't been sick, and his rashes are gone. And he's not even had any trouble with eczema over the past winter. I asked about the diarrhea. It continued to diminish and completely disappeared approximately 3 weeks after I last saw him. Amazingly, all of these changes had taken place after only 2 doses of tuberculinum, which Tyler had taken 7 months earlier. Now, a lot can be said about the remedy tuberculinum, but I'll just offer some of the highlights here. Tuberculinum is a commonly indicated, deep-acting nosode that has the following keynote characteristics. Tuberculinum children are extremely obstinate. They can throw tantrums, especially if their demands are not met. They tend to be bold and fearless. They're climbers at an early age, climbing on the furniture or even climbing out of the crib. They're restless and they can become bored easily. They're thrill seekers and daredevils who lack a normal sense of caution. They're defiant and cannot resist getting their hands into just about everything, especially when they've been forbidden to do so. They can be rough with their pets, sometimes taunting and teasing them. Tuberculinum types are prone to respiratory infections. They crave milk, ice cream, butter, and salty fatty meats like bacon and hot dogs. Alternately, sometimes they're allergic to milk or dairy. Young tuberculinum children often sleep in the genupectoral position. And finally, tuberculinum is one remedy among others that can be helpful for health problems that result from vaccinations. What was fascinating to me was that Tyler's case demonstrated both polar opposite phenomena regarding milk and dairy products. His mom craved milk and ice cream during her pregnancy, which I thought could be the cravings of her yet-to-be-born child, and Tyler later became allergic to dairy starting at around 10 months of age. Also of interest is that, in addition to the many positive changes, Tyler responded to tuberculinum with a prolonged bout of diarrhea. We can state with confidence that this was a healing response because the end result was so positive. A healing reaction can often take the form of a discharge. Tyler's diarrhea was an aggravation in the form of a discharge, and it was reminiscent of his milk allergy symptoms when he was an infant. So in summary, 2 small doses of a remedy generated a prolonged aggravation that echoed old dairy allergy symptoms while simultaneously helping to resolve vaccine-induced skin problems, respiratory problems, language delay, and behavioral issues. It's quite possible that this homeopathic intervention will prevent a lifetime of potential suffering that could have required an endless cycle of allopathic drugs. Well, I hope you enjoyed this installment of the Clinical Case series. Don't forget to subscribe to the ATH YouTube channel, and please join me again for the next episode of All Things Homeopathy.